Hello, my name is Jen Nolan and I work for Musculoskeletal Australia. Musculoskeletal Australia is currently managing the Victorian Active Ageing Partnership on behalf of the Victorian Government and in collaboration with Monash University and Fitness Australia. The aim of the Victorian Active Ageing Partnership is to increase physical activity opportunities for older people, especially older people who may be socially isolated, lonely, disadvantaged, or basically not currently involved in physical activity. Throughout the project, we've developed a range of strategies and tools for the use of service providers who work with older people in physical activity settings. This suite of short films is designed to provide you with strategies and tips as to how you might better engage underrepresented groups of older people in your physical activity programs. I hope you find the films useful.
What the evidence has shown us consistently is that there's a vast range of benefits that older people can gain from taking part in organised and group-based physical activity. There's the physical health benefits in terms of chronic disease prevention, improving physical functioning and mobility. There's the mental health benefits in terms of improving people's sense of happiness and well-being. And of course there's the social benefits that come from participating with other people and building friendships and connections, which make an enormous difference to people's quality of life. While there's a range of opportunities available, many older people don't know what's there, even in their local area. And this is particularly the case for disadvantaged and underrepresented older people. We're thinking particularly of people on low incomes who come from culturally and linguistically diverse backgrounds, people with disabilities, those that are living alone. So one of the important challenges for providers of these physical activity programs is to understand the kinds of barriers that underrepresented and disadvantaged older people face just to knowing about their programs and what's available. So the research that we've been doing in Victoria in recent years has been looking into the kinds of strategies that are helpful in raising the awareness of older people about the organised physical activity opportunities in their areas. And some clear things have come out. One of these, I guess not surprisingly, is that word of mouth is very important.
The program has literally grown actually through word of mouth. So it's the referrals that comes in are usually self-referrals. We take them through the process of My Aged Care registration, but it has been actually through the word of mouth of individuals that have been attending that program.
Another important channel of awareness raising is direct referral. What that entails is organisations and agencies such as aged care assessment teams, general practitioners, community health services, identifying older people whom they're in contact with who could benefit from taking part in an organised physical activity program in their area.
3 سال اینجا بود، بعد 1 سال دیگه شده که اونجا رفتیم جیم.
Actually, she had problem with her legs, and her family doctor referred her to here.
We get referral from ACAS, Aged Care Assessment Services, and also Eastern Health, doctors, surgeries, and other service providers.
The Community Health Service were also fantastic in assisting us. So they really did put the word out for us when they were going out to assess their clients. They really were very helpful to us when we were recruiting people.
The referrals to our programs is actually through the My Aged Care portal because it's actually listed. However, we have done a fair few promotion of the programs either through the regional assessors network or through other network agencies that we may be a part of.
I'm getting managed by VAAP Care and they suggested me coming here and I haven't looked back. It's been marvellous.
The research that we've been doing has also sought to investigate the kinds of information channels that are particularly useful. There's newspapers, there's newsletters, there's flyers, there's posters, there's information that's available on community service databases and on the internet. What's come across is that what's beneficial for awareness raising is to take a multi-pronged approach, to try and disseminate information about programs across a wide range of channels.
We did quite a bit of advertising. We also did print off a lot of flyers. They're advertised at libraries and GPs, hospitals, seniors groups around the Knox area. We advertise at our customer service desk as well.
Another strategy that providers of organised physical activity programs can take is to be out and about in the community, to visit shopping centres, to be a part of local festivals and annual events that may be conducted by councils and other agencies, to be around to make contact and to communicate to other services and to older people themselves about the programs that are available.
I did also have to go and speak at a few forums and sort of large gatherings to get the word out. One particularly successful one was where I spoke at a community house where they did have a cooking session on that day, and I was invited to just mention our group, and we actually recruited about 5 people from that day.